Welcome to Identity Unboxed, where we provide mentorship and promote representation for Black professionals in the advancement of the Black community.
We are seeking guidance from exceptional Black leaders, scholars, and professionals with expertise in their respective fields.
We hope to foster a space that promotes authenticity, inclusivity, and restoration for our listeners while exploring the intersection of our personal and professional lives.
This project is a culmination of our lived experiences as young Black professionals to transform our life trajectories, to overcome adversity, and reach triumph.
Our intention is to inspire you on your path to discovering your purpose. Well, good morning, Jamie. We are so grateful to have you on Season 3 of Identity Unboxed. You are the President and System Chief Operating Officer at Seattle Children's Hospital. And today we're really looking forward to diving into your career journey of coming into healthcare and being Black in the boardroom while connecting the dots of health equity. And our first question for you is, can you take us back to the moment that you found your interest in healthcare and how you identified your path to leadership at the C-suite level?
Yeah, sure. So I would say, I didn't have that aha moment saying I wanted to do healthcare as I was going through high school and determining what I wanted to do with my life post coming out of high school. And so really, I stayed grounded to some of the realizations of what I experienced in life. So, I grew up in a middle-class family. Growing up in a middle-class family, you have these principles of how can you be have that perseverance? How can you have that discipline? And really, the importance of a strong community support system there. And, when I look at the values of that and how I was raised, what really came to fruition for me was that healthcare aligned with those main principles. And so as I was starting to explore what I wanted to do, I kind of really start leaning to that healthcare industry, going into undergraduate college degree there. I think early in my college years, I had a variety of different internships and fellowships to kind of determine, what did I want to do in healthcare? Originally, I thought, I want to be a physical therapist. Then I was like, no, not sure that's what is right for me. And then I had some internships in public health. And then I had an internship in a hospital. And that really hit home to me to say, oh, wow, I was able to see how leaders function in a hospital, how they develop strategy to improve the well-being of a community and the patients that come in the door every day. And I was like, wow, this is where I can really make a difference. And that's kind of where I really started centering my focus on healthcare and in hospital administration. And, I really think of it at the end of the day, it's getting grounded into, where your passion is and what impact you can make to others. And, as I was pursuing in my career with the aspirations of being in the C-suite, I quickly, realized that I had to really be a generalist. And what I mean by that is that element of, being very intentional in your journey about having different levels of experiences. And, that could go from knowing the finances of how to run a hospital to the strategy to operationally how you bring teams together. And, that has been something I've been very much focused on throughout my career. And then really knowing how the whole system works, because it's very complex. And still learning today how it works. But, that has been another essential element for me to be able to elevate into the roles I have been in the past years. And then lastly, I always feel the importance of mentoring and really leaning in from other leaders that you have, as you go through your journey, really aspire like, oh, I like how they did this, or, oh, I learned a little bit of that, that I can apply to me as being a leader. Because I feel that's essential, with the complexities of being able to have people that you can support on for advice, use as a sounding board. And that has been crucial too in helping me to, get to where I am today.
That is so amazing to hear. And I just love how you described the exploration phase early on in your career, that you weren't too dead set on a certain pathway and you kind of allowed your passion to guide you. And like you said, you're a service oriented person. And so you found your way into healthcare kind of naturally. And I also appreciate the point you mentioned lastly about mentorship, because I was going to ask a follow up about that. And as you've, ascended into your career now to be a leader at a major organization with so much visibility, did you have any mentors along the way that have significantly impacted you at all or just gave you really helpful advice?
Yeah, I was telling one of my mentees the other day because I'm committed to, giving back to others now where I'm at in my career. And I was telling her that, I have about 12 mentors out there, and they are a variety of different mentors. I was telling this person I have mentors related to Black female executives that I can relate to and reach out and have a conversation with. I have female executives of all different races that I have connection with. I even have, white male colleagues that are mentors to me because you have to know also, all the various different perspectives of what comes into play. So I always diversify my mentorship advisors. I call them advisors because they do advise. I mean, it could be things from, if I'm having an issue, to even when I was searching for jobs throughout my career, I would touch base with them and get their advice on things. So I think it's critical to really have those levels of insights coming in as you really try to pursue your career.
Thank you so much for speaking on the importance of mentorship. And I was wondering also if you could elaborate a little bit on the importance of finding internships while you're in college, because I know a lot of students,
Yeah.
they graduate and they're like, oh, what do I do now? I don't really have experience in my field. And I know for me personally, it was very beneficial that I did internships in college because I was able to network and make connections and kind of get my foot in the door at certain places. So I was wondering if you could speak to that a little bit.
Yeah, it's very hard to figure out what you want to be when you grow up, right? Because when you first get in, sometimes you have input from your parents, sometimes you get insights of, oh, I want to be like this one day, what I see on TV or what I hear or read. And I really feel internships gives you a real understanding of like, is this somewhere I could fit myself in? And I'll give you an example. Like I thought I wanted to do public health. And I think this is where I can get down to the grassroots level and really make a difference in those that are most vulnerable. And then when I started to experience it within an internship, I'm like, wow, this is a lot of bureaucracy. Wow, I don't know if this is the impact that I can make the most significance into the community. And so, if I made that my path, it would limit, this funnel, vision of saying this is what I was going to do. So I really encourage people to do a variety of different internships. And there's no harm in it because, most of the time people are happy to have you, free labor, cheap labor, and you can sit back and listen and see, really how things are functioning within an organization.
That's awesome. Thank you so much for that. And diving a little deeper into your personal journey, you've been in healthcare administration leadership roles for over a decade, leading complex health organizations across the country. Reflecting on your personal and professional life, what is a salient challenge you have encountered as you've elevated in your career, and how did you overcome this?
Yeah, I feel as you go in you have to have balance, right, in your personal and professional life. And I think you don't learn that easily as you start off in your career because you're trying to prove yourself. You're trying to elevate to where your desired aspirations are for your career. And then you have a family, and then you got to focus on making sure you raise your kids to the best that they can be to contribute back to the community. So throughout that journey in my life, there was some times where things were off balance personally and professionally. Now I'm an empty nester. I have to be careful, like don't swing too much professionally because I have all this free time. But also, how do I balance the life of, making sure I enjoy my life and, with my husband and now my adult kids of what we can do on that personal end. And, I really, one of the things I always try to stay grounded is I feel it's very essential for people to understand their why. I feel like what I keep focus on for myself is that, I say I'm a human being caring for other human beings, and that keeps me grounded. And when I say those other human beings, it's, my family, it's my team at work, it's our patients that we serve every day, and also a community that we have to serve. And I keep that focus with knowing, there's these, what is that metric of success? It's really seeing the impact that you can make. And I'll give you an example. When I was in Detroit, Michigan, there was a doula program that we developed. We were in a very underserved area. A lot of single moms didn't have a support system to go through their pregnancy. And one of the programs that I helped organize was around finding lay individuals in the community where they lived to get them trained and then help them establish relationships with these single moms. That's making an impact, right? And that's where I personally felt like I was grounded in what I am here and my purpose and my passion of what has been given to me as my talent. I think the other piece that is always around when you're in these leadership roles is the culture of what you're trying to develop in the organization, and then living by it, right? Because you can put words of culture on a piece of paper, but is that really being embedded into the actions and the behavior of an organization? And I really take that to heart because we have a mission, we have a purpose of what we have to provide here, and to make sure we are effectively living to that mission is essential. And so as I go through these challenges, it's always know your why and stay true to your culture and your mission of why you're here. And then everything else, some way or another, as you go through these headwinds, we'll usually figure a way out of it.
That's so valuable. And I really appreciate the point you mentioned about how your metric of success kind of changed as your life, evolved. You started, having kids and a family and things like that. And I think it's really important for leaders like you to kind of set the tone of like the workplace culture that there are other aspects of our lives that we need to invest time into, and that being a C-suite executive doesn't mean that you work 60-hour weeks and nothing else matters, right? And so I was hoping you'd be able to describe a little bit more. How did you start to define success for yourself as you began to, move up and get promoted and things, and all these competing responsibilities started appearing in your life?
Yeah, it's a great question. When I feel like when you're starting off, there's two elements. You have hard and soft skills, right? Your hard skills is around your competency, learning as much as you possibly can so you can be competent in your field, right? And that goes through experiences, it goes by the mentors you have, and then various different jobs you have. And that's somewhat what you control, right? Um, when it gets to the soft skills, I think that's the piece where you got to go, okay, how do I connect with others? How do I build relationships? How do I effectively communicate? How do I actively listen, seek to understand, and then be understood, right? Those are a little bit different skills you got to pick up as you grow in leadership. Because when you're young in your career, you kind of control everything that you can because you got a specific job and you got to do what you have to do. As you progress in leadership, it actually gets harder. People think I have control because I'm a president and COO, but I have less control. And that means I have to be able to influence others by what story are we trying to develop of where we want to be for an organization? Because now I have to cultivate others to follow a path of where we want to be for an organization. That's much more of a soft skill that you have to develop over time, and kind of getting into that more, getting out of the forest, but looking at it at a higher level of visibility.
That's so helpful. And yeah, those relationships matter so much. That's a big thing. Every single one of our guests have said is go out and cultivate community and be intentional about it.
Yeah, thank you so much for that. I wanted to ask you as well, what do you do to fortify your mental health outside of work? And what hobbies do you have that are fun? Because I know you mentioned the importance of staying grounded and not having your work be your entire life. So I would love to hear, like, personally, what strategies you use to protect your mental health in a leadership position where a lot of eyes are on you, and what you do outside of work to enjoy yourself.
Yeah, thank you. My family is, I keep that as my top priority, right? And I really intentionally, we do either small trips, we'll do big trips, and we'll really try to spend quality time together. Now, it gets harder as, we have adult children, but we have made that commitment, and that has been something that I will make time for my family. I think personally for me, I have a strong faith and that keeps me grounded and keeps me focused on why I'm here and what is my purpose in life to be given to helping others. And I keep that at my forefront and keeps me balanced because you can lose sight, as you get up into these leadership roles. And so that's very important to me. The other piece for me is that, I think physical health is very important. It comes in either I take a walk or I go on a short run or, meditate. Those are things because to me, I have to quiet my mind and focus and breathe and understand and keep aligned of why I'm here and what I intentionally need to do to help my family, but also help those at work, but also help myself. And I think it's so critical because all the pressures that we, have around us is, how do you quiet your mind and relax? And you have to be very intentional to do that.
That's so great. And yeah, movement is so important. I highly encourage people find a type of movement that you enjoy. If it's not meditation, it could be like just taking a walk, like you said, getting out into nature. And so, yeah, that's fabulous. And just pivoting a little bit, Seattle Children's serves as the Pediatric and Adolescent Academic Medical Center for Washington, Alaska, Montana, and Idaho, the largest region of any children's hospital in the country, according to the Seattle Children's 2024 fiscal year report. Can you describe how you prioritize your initiatives for the organization when you are managing demanding and competing responsibilities? And then additionally, can you describe a few strategies on how to understand your unique leadership style?
Yeah. So I always feel it's always important to know the history, right? And so Anna Kleiss and a group of women came together with a passion and purpose to care for every child, regardless of their ability to pay. And that's going on, we're going on like 118 years. And so one of the things is how you keep that history going for the next 118 years. And for us, we really, as I said, even in our prior questions here, is grounded in your mission, right? Hope, care, and cures. That's what we're here for. And really, how do we make that come alive within our organization? I think important as you're in healthcare, you have to listen, understand, and engage with your various different constituents, right? And that might be our clinicians, that might be our researchers, our staff, definitely our community, the families that are coming to see us because I really feel that voice is vital for us to make sure we're doing what we can to care best for our families, but also address any challenges that we might have to address as an organization. We have big plans here. We have this 2040 vision, and it's really about how can we better serve the pediatric population in the whole WAMI area, which is like you mentioned, is one of the widest regions that a freestanding children's hospital has to cover. And so we have to develop this integrated network of services. And, all the way up from Alaska to Montana, Idaho, and, even, of course, within our local states. And that means that, we have a driven purpose of making sure that we're the global leader of pediatric care within the side of the country and hopefully getting into that national, international level. The awesome thing here is the level of research and the level of discoveries that happen here. That is another way of how we keep aligned to, what we are here intended to do to help, cure diseases that are really impacting our children. And that could even be from mental health, that could be from cancer and so forth. And with that, really comes to, I would say, this integrated network. We're trying to get into a phase of where we bring care closer to home. Not everyone wants to travel as far. And so what you'll see with us in the coming years, we're starting to expand in areas where the need is most needed. And that's in the South region. That might be down in Oregon one day. And so we're really trying to figure out where the families live and making sure we have the necessary services they need locally, and knowing, when they have to come see us for the most serious things, they will come to one of our, campuses to get the necessary care there. So, that has been kind of the focus of what we've been doing at Children's. For myself as a leader, I make a personal leadership brand for myself. And that has been some of the things I've mentioned earlier in our conversation, is just being a very strong mentor and coach. I mean, when you get in these roles, you're really coaching other teams of moving forward to a strategy and purpose of where you need to be. And that means you got to be collaborative, you got to be curious, you have to be action oriented. And with the ultimate outcome is to get the best quality care we can to every family that comes in here. So I feel like, when I look at these superpowers you have when you get into these roles, it really breaks down to making sure you can see the big picture, really understand and hear people's perspectives and gather that information, and then set a North Star, like really get focused on, okay, this is the path of where we're going to go, which I mentioned, that 2040 vision. And so that is some of the key elements as you get into your leadership style that you really got to stay focused on.
Thank you so much for that. I was wondering also if you could speak to the importance of empathetic leadership, because I could imagine in a place like Seattle Children's, it's very fast paced and it could be very cutthroat because it's such a large organization that covers so much. And if you could speak more to some strategies to make sure that people feel seen and heard and valued in the workplace as a leader.
Yeah, I agree with you. Yeah, you really got to stay focused on, are you hearing people? And that's, to me, a clear element of empathy, right? Do you hear me? Is my voice being heard? Right. And so there's various ways you can do that. Like we have a variety of different groups within the organization that we make sure we're hearing the voices of the diverse workforce that we have here, and making sure we're addressing any needs there. We have a patient advisory group that they come together, they tell us how we're doing, but also making sure their voices are being heard. We do a variety, when we round, like I actively round in departments, and I'll go ask, folks, how are things going? What things are going well? What are some opportunities we can work on? That's making sure that they see me, right? Because they see me on an email, they can see me on a screen, but they also get to know you personally, right? And that's how, for leadership, it's getting harder for leadership because there is like this ivory tower mindset. And so I very much intentionally make sure people see me at all the different levels within the organization, or I'll go visit one of our clinics and have a roundtable conversation. So I think with empathy, the biggest thing to me personally is that, are people being heard, and making avenues of how they can be heard. And that's important, I think, as you get into leadership roles.
That's so fantastic. And I just really appreciate that you mentioned eliminating the hierarchy, even as, a president and chief operating officer. Like, it's so nice for folks probably to just get to know you. Like you said, you go and like do the roundtable discussions. You're not just with the other C-suite executives making these plans. Like, you have to go to the community and meet them where they are. And so I think that, yes, is a mark of a great leader.
Yeah. Now, and it's something, go back to my upbringing. I came from a middle class family. I had to work my way up through college. I started as a bus girl, went up to being a waitress. So I don't lose sight of that. And I take pride in how I was raised. And it also helps me ground how I interact with others, right? So I had the privilege of being lifted by many to get to where I am today, but I don't forget where I came from. And so I think that's another important thing as you grow up into these leadership roles.
I love that. Yes, never forget where you came from because it's really the foundation upon which you build your life. And I was wondering also, just to elaborate a little bit on how you navigate situations in leadership where people might disagree with you, because I could imagine as a
Mm.
leader, you can't make everyone happy, and it can be easy to want to make everyone happy and appease everyone. But how do you balance, being empathetic while also having to set boundaries and be firm because not everyone may be happy with certain decisions that are made?
Yeah, that's a hard one because there are decisions we have to make that we feel is best for the organization, and to say you can get 100% agreement, that's rare, probably never. So, I think the key thing as you go through decision making, right? And I kind of alluded to it before, gathering all the different perspectives, right? Because you have all these advisors that come to you with their insights and perspective on a particular issue that we need to resolve. You take that in. I always feel the experiences from the team that's around there of, things they've learned from other places they've been or other experiences similar to this. And I always say we are humans and we try to make the best decision, but we do make mistakes. And I tell people that. And some people think leaders can't make mistakes. I was like, no, I have made mistakes and I will acknowledge when I make a mistake because I think we are trying to do what's best. Our intentions is what is best for this organization, right? And sometimes it is some hard decisions that we have to do, that is what will help the organization strive for the next 118 years. Some folks will understand that, some may not. I think it's very important to explain your rationale, why you made this decision, and also, what's the pros and cons of it? Because there's a pros and cons to every decision. Not everything's 100% green, right? You might have some of these yellow reds that might come up along the way. And I think the other piece, which I teach my leaders, when you make a decision, you will pivot from it, right? You might have a clear path, like this is exactly what we got to do. You start going through it, oops, I need to pivot. I need to pivot. And that's okay. The key is knowing when to pivot when you start hearing things coming in, like, oh, we didn't think about that. Let's shift here. That'll make you a more exceptional leader, I feel, because knowing when to effectively pivot when something may not go the way you are. Because some people might be so tunnel vision that they don't see that.
Thank you so much. That is so valuable. And switching gears a little bit, according to a study conducted by Pew Research Center in 2022 on Black Americans' views about health disparities, experiences with healthcare, 40% of Black adults surveyed said they had to speak up to get proper care, the most frequently cited negative experience with medical care across all concerns in the survey. Additionally, among Black women, 34% say their women's health concerns or symptoms were not taken seriously in interactions with doctors and other healthcare providers. Black adults at all family income levels are about equally likely to report having at least one of these negative experiences in the medical system. And we were wondering if you can share the importance of representation in medicine and why it is critical that medical professionals from Black and Brown communities deliver healthcare.
Yeah, I definitely feel strongly that you have to have representation in medicine. And that's like even from providers all the way up to even my positions, right, where decisions are being made. And it really has a direct, I feel, outcome in, has a direct output of improving health outcomes, but also achieving health equity. It's very important here at Seattle Children's. I'll give you an example. Like I said, we take care of every child, whoever comes in that door, regardless of their ability to pay. And so one of the things, if that we specifically illustrate this is with our Seattle Children's Odessa Brown Clinic. That started in 1970, and there was a vision to serve a community, to make sure they were being represented in the providers that were caring for them, but also how the care was being delivered in a high, compassionate, and with a level of dignity to everyone. And so those are examples of what needs to be replicated as much as we can throughout the country, right? And when you think of medicine, because I think of myself, like I go get healthcare myself. And sometimes I was like, hey, I want to find, a Black doctor to take care of my needs. And it's hard sometimes to find those. And, I think some of it really gets down to how do you build trust and communication of the healthcare system? Because like I said earlier, it is complex. It is not easy. It even takes me some time to figure out, how to navigate my personal care in there. And just, to our earlier point, to the empathy, are you being heard when you go see your doctor, right? Or when you go see a team of healthcare professionals? And I think having mechanisms of how that happens, and you have that feeling when you walk into a healthcare system, that's important. I think the other piece is, how are you addressing the disparities, the health disparities? And, some of it really gets back into some of these social determinants of health, right? Healthcare is just one sector of, what needs to be provided, but then you have all these dynamics of what's happening in someone's life. It could be their job, it could be their food security, it could be their housing. And you have to understand that, because when people come through the door, you don't understand, like they're having trouble trying to keep their, electricity on, or can't feed their kids, more than, the next 24 hours. They're trying to figure that out. And so it's really trying to understand those social determinants and giving them connection to resources. But people aren't going to be upfront with you unless you have that trust, right? And that, and that's the key, I think, always, as I go back, building trust with your families. The other piece is the team. We are, like here, we are committed to make sure our team is trained and that they're competent understanding other cultures. And that's important. Like when we have families come in for Alaska, they have things from their culture, from what they like to eat, and we need to accommodate that when they come here. So those are things that you got to intentionally do to help build that trust of wanting to come and get care when most need it. And then I think, if anything, it's just that constant fostering of, innovation, of bringing people together, in the community to kind of hear what the needs are, and also being intentional about what we invest our time into to make a difference there. So I know that was a lot, but I think, the key element of it is that we can do better in healthcare. And we have to, because if you look at the stats and some of the ones that you've mentioned, we're still not making the imprint of where we need to be around the health of our Black Americans.
Everything you said was so important, and there was so much to unpack there, but I was hoping to ask you more about like having a holistic approach to healthcare. And you talked about that, like recognizing people's cultures, making sure that we have doctors that understand all of the different lifestyles that people have. And not only just that, but the barriers that are presented to them. And that, like you said, people are trying to put food on the table, and sometimes even just having a balanced diet is not feasible. And so how can we, in the institutions, make it so that folks find getting healthcare accessible, that they can find doctors that look like them, that can relate to them, and also just make sure that you're delivering quality healthcare. And so, it's all fabulous. And then moving forward a little bit, you talked about the importance of having representation from our doctors, the staff, everyone across the whole organization. And we were hoping to ask you about making sure that folks are able to get that medical education, especially those from disadvantaged backgrounds. And the big, beautiful bill signed this past July set a lifetime borrowing limit for undergraduate and graduate student loans at $257,500 per person, reported by NPR, which will impact lower and middle income borrowers disproportionately. The National Institute of Health's 2016 report, Young Black and Still in the Red, Parental Wealth, Race, and Student Loan Debt, shared that college-going Black young adults tend to have parents with significantly lower levels of education and income, are more likely to come from single-parent families, and have substantially lower net worth compared to their white counterparts. For perspective, among this relatively advantaged sample of college-going youth, average parental net worth was nearly 4 times higher for whites, $174,000, than for Blacks at $48,000. And these differences are even greater when focusing on median net worth, which was $101,000 for white families versus $9,497. So major gap there. And then with this research in mind, which I know that was a lot, can you speak to those that may not understand the need for equitable access to education and offer any uplifting words for early career Black professionals on overcoming deep rooted systemic inequities?
Mm, yeah. I think education is one of the critical elements of how you can um, elevate yourself within society, right? And it's so critical. And I feel that for society, um, we have to figure out the educational system because the way it's working now is not going to help. And not everyone needs to go to college, right? So I have a brother that went the technical route. He's HVAC technician, but now he has his own business, right? So everyone has a different path. So I always try to push folks like college is one path, but there's many other paths of professions that you can do, and don't limit yourself there. I really feel that every family, has to have the ability of getting an appropriate education. Um, Unfortunately, as you stated, there's a difference there. And our, society, generational wealth does give some us a head start. And so where do you live, and in where, and if a school's well funded, and you get prepped to take these tests and get tutoring, and have someone help you pay for your college, not everyone gets that. And so to me, it's really important that we try to, even with the limits that came out in the big beautiful bill, is like, how can we still make sure that happens, right, on our own. And I'm hoping, there's still good intentions in our society, that there will be other ways. I think I've read recently some of the Ivy Leagues are saying, like, if you're under a certain level of income, you can get a free education. Will more colleges do that? I'm hoping, because I think, as we all know, as long as society is growing and being able to contribute, it lifts up everyone, not just the wealthy. Um, so I think, if anything, when I say, those uplifting words, for early career Black professionals, is that, embrace your unique perspectives, right? I feel like the way you were raised, it happened for a reason. You get some superpowers from how you were raised, and take that level of empathy and understanding from that into where you become professional in whatever field you decide to do. I think the other key piece is community is very important. When you don't have that generational wealth there, available at your, becking need, you have to have other community to build around that. And that might be, seeing what's at the Urban League, seeing what's at YWCA, um, looking at city, or whatever there is. There's other ways. What will require you is to be very intentional about going out and getting those supports, but build a community that can help you get through it, right? Because I think that's critical. And then I think the only other thing I would say is just, honor your journey. It may be hard. Like, I remember I was in my senior year, last quarter, and my parents said, "We can't afford your last semester." And I was like, "I'm so close." And I was like, I was so, I wanted to graduate, and what I had to do to make that happen and get money from a variety of different people, and also work a little bit harder at a job, I was able to get it. But I learned a lot from that. Not everything's given to you, right? And it does mean sometimes you yourself have to dig deeper and figure out, how to make some things happen. But those are things that, I feel are essential as you even get into adulthood.
That's so important, all that you shared, especially about understanding that our unique experiences, even if they don't necessarily fit that profile of someone that, should go to college, that it's still valuable. Because, even for me, I was a first generation college graduate and I came from a low income background. And so, I didn't have that familial support to help pay for my tuition. I was working, and at times I
Mhm.
felt like, I don't know if I can make it through this. Like, I have too much going on. How am I going to go to class? Like, I was so tired all the time. But I realized that as I started moving up, throughout college, that I needed to be in the rooms where decisions were being made and start speaking to the leadership, talking about challenges that low income students,
Yeah.
face in an environment like the University of Washington. And so, yeah, for me, I realized that I shouldn't, be ashamed of where I come from when I'm in these institutions and try to assimilate or, fit in to feel like I'm,
Yeah.
in the prestigious institution, but that I should just be myself, be authentic. And so, yeah, I really found that I was able to grow into that more, and that it was appreciated in those rooms where
Yeah.
some other folks couldn't relate to my experiences. So, yeah, thank you for
No.
bringing that up.
Yeah. And to your point, I would say at first I was embarrassed of it. I'll be frank. I was embarrassed, like, because you're around these folks. I was like, gosh, they had a different life than I did. But now, like, I tell people, like, hey, this is my journey, and tell people you got to trust the journey, right? It's hard when you're living in a moment of it, but you there's there was this path that was developed for a reason, right? And you got to trust, your voice, your intuition, and the power of your story. And that's I probably didn't hit me until I was probably in my 40s, to be frank. That I was like, what, I'm going to share my story because it was not easy. Because, some people assume that I get in these roles for whatever reason, if I'm a DEI hire or whatever it might be. But I was like, no, no, this is my journey. And I earned every bit of my journey to where I am today. And it, of course, with a great community of, like I said, mentors and family members, but you got to take pride in it.
Thank you so much. And I just really appreciate you sharing your journey and the struggles you had. And it's amazing to see how far you've come. And I know it'll be an inspiration to a lot of our listeners, and particularly young Black girls who aspire to reach those heights but feel like they can't do it somehow, or there's too many obstacles in the way. And I'm not too familiar, to be honest, about like, pathways to getting into certain positions in the medical field. And we mentioned how expensive college can be and how some people and their families just can't afford it. So I was wondering if you could speak to maybe some alternative pathways to getting into the medical field, that might not be a 4 year college or institution,
Uh,
even if it's not like becoming a big doctor one day, just like
yeah,
alternative pathways.
yeah. Yeah, there's so many opportunities that people don't realize. I mean, you can go to get associate degrees and be a surgical tech. So you can 2 years of that. You can get certification to be a medical assistant, income and entryway. And what's been great in healthcare, there's so many entryways to come in. I met one of our employees that started out like an environmental services or a supply chain technician and work their way up and becoming a nurse, right? So there's, I think a lot of people think healthcare and nursing and doctors, but there's so many other fields. Like we need people in IT, like I mentioned, we need people that deal with supply chains, making sure supplies get to our units. We have people in business, we have people in legal. So that's the wonder of the system here, is that there's so many opportunities you can grow into it, and you don't have to take just one single path. And so what I say is that you can get a certification, you can get an associate degree, you can get a baccalaureate degree, or you can all go PhD and all the way to a physician. And so I think if anything is trying to better educate high school students around those opportunities, because I think we could always do a better job there.
Thank you so much. I really appreciate it. And going back a little bit, it just made me think about, some lack of trust that communities of color, especially the Black community, can have when it comes to the healthcare field, just because history of medical racism going beyond what we see today, like eugenics and scientific racism and things like the Tuskegee syphilis study. And I was wondering if you could speak to strategies that some may use, or just what you think should be done to improve the trust that Black communities have in the healthcare system when there have been like intentional efforts in the past to harm Black communities? Because I know like when the vaccine came
Mhm.
out, all these stuff, like a lot of Black people do not trust the medical system and
Yeah.
did not. So how can we improve that?
Yeah, systemic racism exists, right? I've been at 5 different organizations, and I have to say it exists in all of those 5 organizations. So unfortunately, that's one of the things we have to deal with in the healthcare system. I think if anything, it gets back to education, people understanding their rights in the healthcare system, but also how to effectively advocate for yourself, right? So when I go in, and I was at this panel conversation over the summer. Like, if I don't get a good feel with my doctor, I'm switching it. And I'm like, and that's, some people just stick with it, that person, but you got to be able to develop that relationship with your provider and get a good feel, right? Um, and and take ownership of it. If you don't like it, switch it. And also make it known if you feel like you're not being heard. There's a variety of, when you come in a hospital, if you don't feel you're being treated fairly, we have people that will come interact and address it. And I think that's where people don't know, like the system, right? So if you're not getting what you need from your healthcare team, elevate it up. We usually have patient relation teams that will come and engage and make sure, we get to a common understanding between the provider and the family. If we got to switch the provider, we'll do that. And then, the other thing, if you're not happy there, I always tell people go to the next level of within leadership. And I think that's the thing where we might pull back and say, I just don't trust it. But if we do that, we're not taking care of ourselves. And you all see the stats. We got to start taking care of ourselves. And the only way to do that is get the necessary screenings, get the necessary immunizations, to prevent us from getting any level of disease. And so that I know it takes some time, but you gotta, I guess when I say if you don't trust it, you're going to have to advocate for yourself more often.
That is so important because many people don't realize they can advocate for themselves, like you said, and that if they're not pleased with their doctor, you can find a new one, and that there's resources for you to do that and to not just give up on your health because, like, that is the most important thing we have, right? We have to take care of ourselves, like you said. So, yeah, thank you so much.
Yeah, and switching to a personal note, you've just come so far. I know you mentioned working in the service industry and doing internships, and now you are able to be of service of so many people. And we were wondering if you could reflect on yourself as a young Black girl from the position you're in today. What words of wisdom would you give her?
Wow. I kind of go back to what I said. Trust the journey, stay curious, stay determined, and stay connected to your purpose. That's what I would say. And something I probably didn't know when I was back in my 20s, but over the years, when you sit back and reflect on that, that's what I would tell my young self.
That's great. Yeah. And like you said, just reframing kind of your journey and realizing that it's all amounting to where you are today. And that's so funny that, as you had mentioned, you realized that at like 40 years old. And so people don't recognize that, like, it takes longer than you think, right? Even if you're dissatisfied with where you are now, it's all going to make sense, right? And so there's something positive to look forward to.
Yeah, it's kind of interesting because my kids are 25 and 29, and
Okay.
I was talking to my 25-year-old. He's like, I don't know what my purpose is. I'm like, you're
Yeah.
only 25 years old. It's
That's
like it
funny.
takes time.
Yeah.
You'll be fine. It takes time. So I was like,
Yeah.
explore. This
Mm-hmm.
is your time to explore and kind of figure that out. But yeah.
Yeah. Yeah, that's great. Well, thank you so much. This conversation has gone much faster than, I even thought it would. It's been fabulous. But just our last question that we ask all of our guests is how your identities influence who you are, which you've kind of already alluded to that. But particularly when it comes to Blackness and how you relate to your Blackness and also how you take pride in it every day. And so our last question is, what does Blackness mean to you?
Yeah, when I saw that question, I kind of break it up in two things. On this earth, I feel it's a shared history. I feel there's shared struggles, and I feel there's a shared cultural expression. That's what's unique when I think of Blackness, to me personally, and that journey that you have, as you're on this earth. I'm hoping once you get to heaven, all that is gone and that disappears, and you have that true sense of equity, right? And unity. And so, I kind of look at it when you're on earth, but also when you're in heaven, you get that unity of what we all desire to be. And so that's kind of when I step back and kind of think of that question. That's how I positioned it.
Thank you so much. Yeah, that's so important and a great way to frame it because race ultimately is a social construct, but it matters in the concept in society in general because it has been used to oppress people and to create different barriers for folks. And so at heart, we are all one. Like you said, hopefully when we get to heaven, we feel that connectedness. But in the time, right? But in the time being, race does matter in the context of society. So I love the way you framed that.
Yeah.
Yeah, that's great. And yeah, unity, that's one thing we've talked about with this whole podcast is we've been continuing to grow this community outside of Seattle now, which is wild. It just started with people we knew in our own networks, and now we're interviewing people in other states, LA and Atlanta and DC, and we're just like, how did this happen? But we're all unified around this, I think, shared pursuit of liberation and justice for the community because we haven't always seen that in the past, and that,
Yeah.
we know that we show up, and if we liberate Black people, everyone else also elevates because of that.
Exactly.
And so, yeah.
Exactly. And
Yeah.
I am so impressed with both of you for doing this and being committed to sharing the stories because I do believe it helps. And
Well,
so
thanks.
kudos to you both.
Thank you so much. Yeah, this has been great, and we hope to stay in community with you. We try to with all of our guests, so we'll keep you updated on all the news and stuff that's happening. And your episode will come out in the fall. So
Okay.
thank you.
All right. Thanks. Take care.
Have a good Friday and
Thank you.
weekend.
Thank you so much.
Bye.
We deeply appreciate your support as we work to uplift the Black community and explore our unique experiences within the Black diaspora on Identity Unboxed.
Authenticity is your guide to cast an impact on the world that you will be proud of. Signing off with pride, Tiana.
And Brad.
Thank you so much.